AM 1220, KHTS, your hometown station. I am T. I am here with you every Thursday with something we call Dr. Proctor, that opportunity to peek over the shoulders of the medical community and support staff, people taking care of you with everything that is happening in the world today. You know, they have what's called the silver tsunami. People are aging. There become more medical issues. There's also so many in the sandwich generation, either taking care of children and parents or even grandparents. And with affordable health care, everyone has access to doctors, to hospitals. What this also means is they are incredibly impacted. And the best thing we could possibly do for them and for ourselves is be our own best health advocates, which is why this show came about, because I felt there was a chance for us to be our own best advocates. The more educated we are, turning to the internet can be a very scary landscape and often wrong, and therefore the more opportunities we have to get appropriate and honest and accurate information for healthcare for ourselves and for the people we care about, the better it will be all around. Today I have with me Lisa Solis DeLong. She has been with me in the past before. She's an author. She was also a nurse, an unbelievable caretaker. She's become a speaker on behalf of bereavement and in helping families through very difficult times of life and transitioning. And with me is also Pauline Matar, who is a PA, and we're going to talk a little bit about that. Ladies, thank you so much for being here today.
Thank you for having us, T.
All right, so Pauline, first I want to point out that yes, you had a long night last night, as far as you had to work. So thank you. I'm very grateful to you not only for your work and your service to the medical community, but the fact that you've come in to have a conversation with us today. What you do, it's a tough job, yes?
Yes, very.
Tough job and tough training to get you to that place.
That is correct.
Now, talk to me, first of all. Tell me where you work. Tell me what you do, and then we'll get into a little bit of what led you there and what it took education-wise to get there. So tell me first your title and where you work and a little bit about that job description.
So I'm a physician assistant, and I currently work at two different hospital facilities. One is Allen Valley Hospital in Lancaster, California, and the other is at Cedars-Sinai in Los Angeles. And I work in the emergency department at both of these facilities. So it's very, very busy, lots and lots of patients, and very fast moving.
I like that you didn't add the words stressful or frenetic or the things that would be associated with the negative. For you, it's fast paced. And you're taking care of patients, so your heart shows through what you do. What's a typical shift like for you?
So I do 12-hour shifts at Allen Valley and 8 hours at Cedars, and we see a good majority of patients, especially now with Obamacare. A lot of patients don't have very good access to their own primaries. Their appointments are about 2 months out when they do try to make them. So we've kind of become primary. So we see a lot of patients, a lot of patients that are coming in wanting help, wanting answers, wanting to get things looked at. And we do see a pretty high volume of patients in just a 24-hour period.
I've been to the ER a couple times myself in the last 4 years, and just a couple of weeks ago, I actually was carted off to an ER, and I was shocked that there were people out the door and down the street. This was on a Monday night, and it was every possible illness. Give me kind of a broad range of what you see coming in through the doors.
Anything from cough and cold to a stubbed finger, and all the way up to literally people are
life and death situations, gunshot wounds,
correct,
and car wrecks, etc. So. It's never polite to ask a woman her age, but I'm going to do it because it's radio and we're not going to offend you. How old are you?
I'm 31.
And how long have you been doing this?
I've been doing this for 4 years now.
You look fabulous, by the way.
Thank you.
You're exhausted and you've been at this for a while, but you look fabulous. What led you to this career?
I ever since I was a child, I knew I always wanted to do medicine. I was always in and around hospitals for family members. I had a couple family members that had cancer, so constantly in and out of the hospital. And I always loved watching the nurses and the doctors and seeing them work. And I constantly asked questions. And so I knew that one day I was going to end up in medicine. I didn't know what I was going to do. In high school, I did a medical magnet program called the Health Careers Academy. So that was a really nice segue into.
This was in high school?
In high school, yeah. I got to go to the hospital and shadow different medical professionals, from the phlebotomists to transporters to the nurses, and really got a nice close-up view for just being a high school student, which was really great. It helped open up a lot of doors for me. I ended up getting hired when I was still in high school to work in the emergency room, and I was in ER tech for 10 years, and then went to UCLA for my undergrad, and then went to PA school after. So with being exposed to the different medical professionals, I really enjoyed watching the physician assistants, and a couple of them had taken me under their wing, which was really nice. And just talking to them, I really enjoyed how much autonomy they had and how much time they were able to spend with patients and explain things to them.
I like that you use the phrase under their wing, because for me, the PAs are always the wingmen to the doctors. You know, the doctors come in and they have a certain aura and a certain air when they're working with patients, but the PAs really are the wingmen, because you are that in that seat right next to them. You are helping drive that craft as it makes its way, and then you're often the liaison between everyone else that the patient is in care with. Lisa told a great story a few weeks ago about her first experience where she had that moment where she knew that this is something she wanted to be part of. She saved a fish. Saved the fish. Well, yes.
I was 8 years old.
8 years old. They caught the fish, and she was panicking because the fish was dying. And you put the fish back in the water, and your mother helped you save this fish's life.
That's right.
You got to see family members. How old were you when you first witnessed this really life-altering moment? How old were you when you saw that?
I was in elementary school, so 5th and 6th grade.
So right around the same age, 9, 10 years old, 9, 10, 11. So it goes to show those formative years when we're building young minds. I don't think there's anything that kids shouldn't be exposed to, so to where they develop their passion. Sometimes they don't get that till later, but I love that both of you women.
Yeah, that's really true. And as I speak across the country to healthcare, big healthcare systems, I'll use a writing prompt to help get to that point for them to see themselves as healers and how to recognize their calling. And so my prompt is, my earliest recognition of being interested in healing was, and then I asked them to write for 5 minutes. And I've done this with audiences as small as 20 people and as large as 2,000. And then after they've written, I help facilitate the conversation, whoever wants to share. And it's amazing how many people are in healthcare today at every level of healthcare, every from finance to food service to MDs to PAs to RNs, the whole system, that they got there because of an incident. Something happened to them in their youth that they had a recognition, a moment of awareness that people need help.
People need help.
And that they're the ones who step in. And that was the whole point of my fish story, was like, I have 4 siblings and nobody else was trying to save the fish.
But it was something that was in you.
Yes. And that's not a put down on their part at all. It's just that's who we are, you know? And so the sooner you realize that, like I'm sure in your family too, Pauline, when you were dealing with, family members with cancer, there were those who could be there and be more present for those people than others. So it's fascinating to me that what's really fascinating to me is when I do this in groups, very often people will come up to me and say, I never saw myself that way. And that's what I love. It's like we just think it's normal to like work in a crazy ER that sees how many patients in a 24-hour period?
We've been averaging 400 to 450.
And not just people in really incredibly stressful, emotional duress. They're under duress.
And I don't want to miss what Pauline just said.
And there's goo and blood and
400, over 400 in a 24-hour period.
Yeah.
That's massive.
It's massive. It's like war conditions.
It really
If
is.
you want to really button it down to what is happening in America right now, it is war. Because once upon a time in an ER, you may have seen, half, a third. Yes, it's crazy. Yes, it's busy. Yes, it's frenetic. This is like being in the trenches where you're seeing handfuls of people every few minutes, and the triage alone, and not everybody is the person who's meant to, stick a needle or in a person or clean out a bedpan. There are so many other elements of the medical community that are critically important. The information intake, the ability to translate that information now to nurses, to doctors, to PAs, to phlebotomists, all of that is critically important. But you really truly are in the trenches, and it takes a particular person. And I love the idea that this information comes to you when you're relatively young, where you see that in yourself. But Pauline, you're also a wonderful example of someone, you're never too old, because you worked in the hospital as a tech, did you say?
Correct. For
10 years.
Correct.
And that wasn't necessarily the train you were going to be on for the rest of your days. You went back to school and knew there's more. I really admired that, because I feel so many times people will say, well, I don't know, and I'm a certain age. Oh, no. This is a world right now. The climate medically is such that if you have that inkling, if you have that drive, if you have that call, you definitely should answer it. So you went back to school. Tell me a bit about that process and what that was like, because you'd been working. You went right out of high school into the work place, and now you're re-entering the academic. How was that for you?
It was good. I worked throughout the whole time I was going through college, which helped me stay in touch with different medical professionals, and I was constantly learning, just being around that surrounding, which was really great. Constantly getting feedback, and again, these providers took me under their wing, and they constantly encouraged me. And it's nice because you get different perspectives from them and different things and insights as far as what you need to do, what you need to take, and things like that aren't on a paper, or when you go look at different programs, you don't always see everything. So every program does have its own requirement. I went to UCLA and graduated, and I didn't take all my sciences there. I ended up going back to the community college and looked at the different schools, and the majority of the schools with the requirements, a lot of the different sciences. So I ended up taking them at a local community college, actually COC here in town.
Yay, shout out COC. We love COC. Yes. All right, and then once did you know that you wanted to be a PA when you started that process? Was that your goal, or was there a secondary goal? Is there more? How did that come to be?
So with the different providers, you have your nurse practitioners, your physician assistants, and then you have your medical doctors. So it depends on the route you want to take. If you want to be a nurse practitioner, generally they go through RN programs and then become nurse practitioners in some form or another. If you go the PA route, you generally do the prerequisites and then you go into PA schools. And if you do the MD route, you have to have your bachelor's and then do all your sciences, and that's a 8+ year program. The physician assistant program is 2 years, depending on where you go, 2 to 3 years. And the nurse practitioner can vary anywhere from 3 to 4 years. PA
is something I feel people really need to embrace and wrap their heads around. So many people will make their appointment and they'll say, I want to see the doctor. It's like, all right, well, that's good. I love that. I love me some doctors. So I started this show. But I also feel like you need to understand that a tremendous amount of patient care and what is needed and what's required can most definitely be met by a PA, and I want to get into that. We're talking with Pauline Matar. We're also here with Lisa Solis DeLong, who's been a long time nurse, caregiver, someone who's been in with her hand in the medical field for a very long time. Lisa, we're going to talk, especially in the next segment, about your relationship and how you tell a story, how a PA stepped in and actually saved your son's life.
Yes, that's
and
true.
We're going to get into that, but I'd like to take a moment before we go to break. Give me your impression of who the PAs are and that you've worked with or have had access with over the years.
Well, I think the PAs fill a gap, just like nurse practitioners. When I was a new nurse, there were no nurse practitioners, and so the demand of the healthcare profession has created opportunities for people with their own skill set and their own gifts, and so the PAs really fill that gap between the doctor who really doesn't have time to sit with you and talk and explain, and they're much like the nurse practitioners that tend to have more time, and they're very hands-on, and they see an awful lot of patients, just like physicians do. But they also have the ability to use their skill set with a little more time available to them to help fill in that gap. So, and they work directly with physicians, so they are the mouthpiece of the patient very often, much like nurses as advocates. And it's really been a positive experience at Children's Hospital LA, where I have the most experience with my sons. That there are some places, some facilities in the country that don't use PAs, and I think it's a disservice to patients and to the community when you're not using every possible category of healthcare professional, because they know what they're doing, and they have a very unique skill set and an eye for uncovering problems and really fine-tuning their skill as a practitioner to see and diagnose, to look at symptoms and put an extra pair of eyes on what you're seeing, on what the problem is. And like Pauline and I will talk at home, because I see Pauline quite often, and she'll say, "Oh, I had this patient that presented in this way or that," and we'll talk about it. And she, it's like, it's such a good feeling when you're the one that gets it. You're
right.
Like, I saw it. It was a hematoma, or this. They just put all the pieces together, and when you're the practitioner who nails it, and no one else saw it,
Right.
And I have had that experience as a nurse too, like being able to start an IV or something that someone else couldn't do, and you have this moment of like, that's what I did this for, like I'm really using my skills, and PAs are really good at that.
And the idea that in the hospitals or the areas where they're not using the PAs, the volume load and the idea that they can help facilitate better health care on behalf of a community does seem like an oversight. When we do come back from the break, I want to talk about how, again, the PAs they have their eyes, their ears, their hands on the situation in a different capacity sometimes than the doctors do, and we'll deal a little bit with how they can help and be of service to not only the doctors but most certainly to the patients. And Pauline will talk a bit more about your process, that transition once you came out of school, and what was involved with that. It's fascinating to me, like when you were talking about you were taking classes at one particular facility, at one school, but then you realized, I can take some of those other supplementary classes at a different level, which is, I think sometimes people forget that. They think, I have to take all of my schooling at a particular university or under a certain banner, and that's not the case. And the more you learn, the more you take back to it. So I do want to talk about that transition. And Lisa, when we return, your history as a nurse and the medical application, and even when you were in the trenches, so to speak, even before your family care, what that meant. You're listening to Dr. Proctor here on your hometown station, AM 1220 KHTS. We're talking with Lisa Solis DeLong, and Pauline Matar will come back after these messages.